everyone, Michelle here, personal trainer and lifestyle coach. Today on the Because You're Incredible podcast, we are joined with one of my good friends, Kyle Zabst, who is actually my chiropractor for a little bit. And
Yeah.
he has come to talk to us about chiropractic care and who it's appropriate for, what it can do to help you, and when it's most going to be able to be a good tool for you. Thank you so much for joining us today, Kyle.
Yeah, I'm glad that you gave me the opportunity to talk.
I'm so excited. So can you tell us a little bit about yourself, your title, where you kind of came from and how you got to where you are today?
Sure. So I started like my medical history, I guess, basically at New Mexico State University. I got my athletic training degree there, which I absolutely loved. Loved that, the school, the opportunity to work there, working with all those athletes and stuff. They really did help me they pushed me to get all of the knowledge that I needed for the chiropractic school that I went to before. The schooling for athletic training is very rigorous. We started out with 45 students and went all the way down to only 5 that finished the program, which is intense, but definitely loved it. And then I decided to continue my education to go to chiropractic school at the University of Western States in Portland, Oregon. We went around to a whole bunch of different schools. It was the best in the area. My wife, Mallory, was interested in the possibility of going to vet school at the time, so we needed one that had a vet school that was close. She ended up not going that route, but it was just kind of everything meshed well perfect to go there. And I operated a few different clinics in the Portland area. And now I'm here at Canby Spine and Sport, which is where I live. So it's really nice. I don't have much travel time or anything, but it's been great. That's pretty much it. I've worked a few different sports, rodeo, things like that, just been the head athletic trainer for them. And it's been very rewarding. Definitely love where I'm at. It's been great.
That's cool. So I don't know if I've thought about or even seen that many people go from athletic training to chiropractic care. Where did that transition happen for you?
It is pretty rare. There's not many. A lot of athletic trainers that I guess want to try to go a little further usually go into physical therapy. And I just always had an interest in chiropractic. Pretty much since I was a junior in high school, it's pretty much what I wanted to do. And I got hurt in football. I guess it's kind of a lot of people's, experience. They get hurt somehow and they see how this person was able to help them feel better. And that's what they want to do. And that was exactly me. Basically, I kind of got tackled weird and my hip kind of got injured, my SI joint. And I went to a chiropractor that also, he wasn't an athletic trainer, but he was a sports-based chiropractor and was like, wow, this is awesome. This is what I want to do. And it's been really cool.
Very cool. And do you feel like the knowledge from athletic training, I know you said that's a sport and spine, right? So do you feel like it's really helped you hone in on a specialty population?
Yes and no. I feel like it definitely, I use the kind of my philosophy with a lot of people in pretty much everything, in car accidents and everything, to try to get them back to whatever their normal is. And I have a little bit more of I guess a more intense, it's kind of the wrong word, but I would rather people kind of push themselves a little harder to get back to their prior levels, kind of in athletic training where we're trying to get them back to sport as quickly as possible. Same here. We're trying to get them back to their normal life as quickly as possible. Some people want people to not do anything for a long period of time, while our philosophy in athletic training is to push you a little harder. And that's basically my thought process there.
Okay, cool. I love that. So generally speaking, when it comes to chiropractic medicine, what are some of the benefits of taking?
Sure. There are a lot of benefits with it. The majority of it would be basically helping you be able to compete or just live at your optimal level. So like we can help you get back to pretty much any level that you were at prior or trying to get to. I work specifically to try to focus on getting you to heal the quickest that you can, and be able to get all the way back from a cellular level to full range of motion to everything, to get you back to the optimal prime level that you can get to and compete at that high level.
Okay. So I hear a lot of getting back to in rehab. So do you work with a lot of people who have had injuries and stuff like that?
For sure. I do focus on that. We do have a kind of a very hybrid practice. We see a lot of different people. But I focus more on that aspect of, we do have like the kind of maintenance care, but majority of what we have are more of an acute rehab type of, yeah.
Okay. So can we talk briefly about acute versus chronic, maybe pain and or injury? Does it make a difference with like who is eligible, or, you know, who's going to most benefit?
Sure. Yeah. It kind of depends on everybody. Obviously, everybody's a little different, but in general, acute injuries are, more inflammatory, like inflammation in the joint or in the muscle or anything that's the tissue that's damaged. While chronic is more of a, where, it's not necessarily a tissue damage. It's more of just a either postural or, you had prior injury where you have scar tissue that's built up. And we definitely focus on both of those, but I am more on the acute side and trying to get people back into functioning as high as possible.
Okay, very cool. So are there any cons or negatives about chiropractic, maybe things you should be careful of chiropractic care?
Chiropractic is very safe. There really are, like the biggest con I would say is that you might be a little sore after, just because those joints have been stuck for a long period of time, and now we're getting them to go back to where they're supposed to be. You kind of like a massage, like after you get a deep tissue massage, you just kind of feel beat a little bit, So that's pretty much the only thing that I would say. But it really shouldn't be anything more than just a normal, very quick soreness afterwards that you can kind of flush out with some water. And that's pretty much the only con to it.
Okay. Now, I do think that there is some polarity when it comes to chiropractors and chiropractic care. So why do you think that polarity exists?
As in every profession, there are good and bad. Chiropractic has their fair share of, I wouldn't say bad, but different thinking. How's that? And I guess it kind of goes back to really how, when chiropractic was founded. It was founded at a time where medical doctors were still treating with leeches and bloodletting. So, the things have changed a little bit since then. And the medical field has improved in a good amount. And some chiropractors still believe that they can cure diseases and everything with manipulation. While there's not much medical backing for that, I still feel like there's a good amount of things that chiropractic can help with, just probably not in the same way that some of the people in the medical community think that we can do. And I think there also is a big thing with big pharma that we're able to help people without having them to get onto medication. And I do think that has a little bit of the effect of that we have a negative stigma because we don't have the funding that big pharma has and things like that they'd rather us not be there, because then people can just take a pill rather than us being able to help them get better without having to take any medication.
Okay. So what is the official educational requirements for a chiropractor?
So you do have to have at least 2 years of a prerequisite class. So you don't necessarily have to have a undergraduate going in, but you pretty much have to. I don't really know of anybody that does get accepted without having that. So basically it's that undergraduate level, and then it's 3 to 4 years of schooling after that, and then passing all of your boards after that.
Okay, so it's kind of similar to almost law school, and then you get a doctorate at the end, right?
Exactly. Yep.
Okay.
Yeah, very similar to physical therapy. Same thing there. Physical therapy is only, they require 2 years before, and then it's 3 to 4 years after. And yeah, pretty much the same.
Oh, do you know if it used to be different at all? Because I know, you did athletic training at New Mexico, which is now a master's program,
Right.
right? So has it
Yes.
elevated throughout the years? Do you know?
It's been pretty much the same for a long time. The big, we're talking way back in Michigan, a few chiropractors were arrested back in like the 1800s because they were practicing doctorate, and we had a lot of schooling that they claimed that they were doctors of chiropractic, and medical doctors even back then were worried, that we were going to, I'm guessing that they were worried that we were going to kind of take some of their business away. So they automatically were against chiropractic back then. So I don't really know where I was going with that, but that definitely is part of it.
Okay. And then there's also a doctor of, is it osteopathic medicine?
Yes.
What's the difference there?
So the osteopaths and chiropractors pretty much were started in the same place. In fact, it's talked that they probably even were founded in like the same community, that they were all kind of trying to treat people. Again, this is the same time as bloodletting and things. So they're trying to figure out different ways of how the body works. Because at that time we didn't really even know. And there was theories on whether it was the nerves causing pain, whether it was the arteries that were causing pain, organs. They didn't really know. They were trying to figure out exactly how to help the body heal itself without having, at the time, they didn't have any medication really. So that was the thought process there. And basically they kind of branched off at that point, one believing that it's the nerves, one believing that it's arteries. And they both have changed over the time. I would say that the doctor of osteopath have definitely gone more towards the medical side, the MD side, medical doctor side, while chiropractors, whether good or bad, have pretty much stayed with that nerve. I feel like we have changed recently, some of them, but some chiropractors are still very believing that it's the nerves that cause everything and that they can heal everybody with an adjustment.
Okay.
Cool. There is a little bit of history that I can go into where chiropractic started, if you are interested in that.
Yeah, go for it.
Sure. So it was started by a guy named D.D. Palmer. He was adjusting a janitor at he basically was talking to a janitor that couldn't hear out of an ear. And he just was like, you have this vertebra that's protruding out of your back, after he heard a pop, and then was like, I heard a pop. I can't hear anymore. So he looked at him and was like, hey, yeah, this vertebra is out. It shouldn't be like that, and moved it back. And then all of a sudden, his name was Harvey Lillard. Harvey Lillard was able to all of a sudden hear again. And that was basically the whole catalyst of being like, whoa, okay, there is something to this, that we actually can help people, feel better, whether it's hearing or pain or anything like that.
Okay.
And the reason that he named it chiropractic is, I think, kind of interesting. It goes back to the Greek word of chiro, which means hand, and practicos, which means doing a function. So it's like basically hands-on doctor, which I think is actually kind of a cool name, because that's basically what we do. We're the only doctors that really put our hands on you to help you heal. And I feel like that's a pretty cool word.
Huh. I didn't even think about that. That's kind of cool. Yeah. So with you being an expert in, I guess, joints, right, would probably be, can you talk a little bit about some of the benefits of manipulating joints versus some of the benefits of something like tissue work, massage, manipulating muscle?
For sure. Yeah. Both are extremely important. There's definitely not one without the other. If we adjusted and then didn't do any soft tissue work afterwards or before or anything, it usually would just go right back, and it would be a very short-term gain for the patient. But in particular with joint manipulation, there are some things that have been found that can help the surrounding tissues as well. So basically what we're looking for is a joint restriction, where the joint isn't moving the way that it's supposed to. It doesn't really matter what joint it is. The joints are supposed to go through a full range of motion, and we're feeling okay, well, that joint, wherever it is, isn't doing that full range of motion. So we get that joint to basically cavitate or do that pop sound. And that forces that joint to go through that full range of motion and then be able to continue moving at that range of motion. That can help with in a few different ways by getting more fluid to the area. That the joint fluid is what helps heal that joint, heal the cartilage, heal the joint capsule. Kind of that fluid exchange is really important for all of that. But we've also found that a local tissue response, you get a dopamine release. So that can help the muscles and the ligaments in the area also relax, which can be very beneficial. There also is a few different things that have shown that it can stimulate the autonomous nervous system, so the kind of fight or flight. And I've seen it multiple times where people will all of a sudden go into a full body sweat afterwards, and they're just like, "That's crazy." I'm like, "Yeah, that's literally your autonomous nervous system getting ready for fight or flight, just because we're basically turning it on, we're heightening it." And so it's pretty cool to see.
That's super interesting. So is there something in the way? Is it muscles pulling? What's the typical issue of why that joint is not going into range of motion?
Definitely. It kind of depends. Sometimes it's honestly just the joint isn't, it just kind of is stuck on itself. Every joint usually has some cartilage in between it. Every joint should be kind of smooth on either side. So obviously if there's injury to that area, like, for example, your meniscus in your knee, if that's there, yeah, you're going to be stuck on that. But just a general joint restriction without anything like that, usually it's just the joint kind of being twisted in a different way. And it can be muscle, it can be ligamentous, it can be honestly just even postural, to where you're, let's say you're in a bad posture for a long period of time, the forces of gravity can pull that joint into a place that now all of a sudden it's stuck.
Okay. Now you mentioned meniscus, so if we could briefly talk about starting to get into some more populations, let's talk really quick about injury. Is there, and I know it depends on probably the injury, but is there a timeline that someone should follow before they start getting adjustments to an injured area?
I would definitely say the faster that you can go in and get at least evaluated, the better. The faster you can get any type of treatment. Doesn't necessarily mean that you have to get adjusted. Obviously, if you have a fracture, we don't want to do an adjustment to that area, but we can do a lot of things that can help that area heal without actual joint manipulation. But for just a joint, like a sprain or a strain or anything of that nature, yeah, definitely coming in as soon as possible to get that looked at. We can kind of jumpstart the treatment line there.
What about pre-post surgery?
It's also a great question. So pre-op is extremely important to the overall success of a surgery. The more that you can do any type of pre-op surgery really can help basically get that range of motion and the function of the whole joint and muscle together. And then afterwards, yes, extremely important. I do some post-surgical rehab, usually more spinal rather than post-op for knees or anything like that. But I am versed in that. Done it multiple times, but definitely not my main practice now. But definitely the more that, even if it's not a chiropractor, going to get treatment right away is extremely beneficial.
Absolutely. And we've talked about that before on some of our other episodes about physical therapy or, at least weightlifting or something like that, right? Trying to go into the surgery in as best health as possible. Yes, exactly. For the best
Super
results.
important.
Yeah.
Yep.
Okay, cool. So then what about, you mentioned spine, what about people that have like scoliosis or a spinal injury?
Yeah, definitely. So there are, scoliosis is kind of a difficult one because there are two different kind of ways that can happen. And scoliosis has a whole bunch of different things a whole bunch of different forces that are a lot of that aren't, quote unquote normal. But basically we can help with the forces that that are caused by that scoliosis. Basically help with the muscles to be able to relax, get the joint moving correctly, as correct as it can. But there are some things that scoliosis will still cause an issue, just actually being the nature of that structural change. In fact, actually with most scoliosis is, you'll actually have the kind of they call it modeling of the ribs, where the ribs will actually, one side will be kind of a shorter concave and one will be more of a longer curve to it, because your body still is the same size. So if your spine's moved over more, your ribs are even kind of changing, and that definitely can cause a whole bunch of different issues that we can't necessarily fix, but we can definitely help it heal and move as fast as much as it can.
And really quick, just on the idea of scoliosis, I don't know why this one always seems pretty crazy, because the only solution I've really heard was like back bracing, right? Which after you're in a back brace for so long, sometimes you don't get your range of motion back and all of that, right? So have you seen progress in any scoliosis patients?
Definitely. Yeah. So I actually have scoliosis as well. That was another reason of me going into chiropractic school. I wanted to do, it was kind of just, I always had some lower back stuff just constantly since I was, I can't even remember. And there are cases of, idiopathic versus postural or functional. And with idiopathic, which is more of the joints, forming that way, versus postural, which is more of you sit on one side for too long or something of that nature, where you have a repetitive motion that's causing that scoliosis, that we can actually get rid of that functional, whatever is causing that, to be able to loosen the muscles on the short side, or strengthen the muscles on the elongated side, to actually get that scoliosis to either reduce all the way or at least somewhat. I've seen that multiple times. I mean, honestly, that's what I deal with a lot. Functional scoliosis is extremely prevalent. I see it, at least 20 times a day. Where I'm, we look at somebody, their leg length is off, and with you standing with one leg about an inch shorter, just with how physics is, you're going to have functional scoliosis with that. And we deal with, that's probably a majority of what I see is that functional scoliosis. It's also known as upper lower cross syndrome, which basically we can help with strengthening some muscles, loosening some muscles, and then really focusing on posture and how we're supposed to be standing, and going forward from that. And it really does help a lot of people.
I love that your approach seems more holistic. I keep hearing other things like muscles and exercise and all of that as well.
Yes, definitely. That's a huge part of it. Mm-hmm.
Okay. Very cool. So what about people with injuries to maybe their discs, or maybe anything like that, and especially the lower back region? I know that that's pretty prevalent. Extremely.
There's a lot of research that's gone into this. Obviously, it's a big part of, not everybody, but majority of people at least know somebody that's had debilitating back pain. And usually it is related to some type of disc injury in the lower back. It can also be in the neck. But definitely very prevalent. And this is something that we definitely have done a lot of research in. In fact, there's a study in 2022 in the British Medical Journal showing that it's called chiropractic spinal manipulative therapy. Basically, they reduced the odds of basically having to have surgery with people that were diagnosed with a disc herniation via MRI. So they saw I think it was over 1,500 people. 1,500 people that were diagnosed with a disc herniation. And they looked at people that went to chiropractic versus not. And they showed that over the next 2 years that chiropractic significantly reduced the odds of that person needing either a disc replacement or a fusion of that lumbar spine. So that's something that has been pretty cool, that we can actually quantify that there is help with that. And that's just through, in this study, it was just adjustments. They didn't really do much other stuff on top of that, which just shows that if we're able to do even more, functional change, changing how they move, things like that, can really improve people's quality of life even after a pretty major disc herniation.
Wow, that's awesome, because obviously back surgery is one of those things that you want to avoid at all costs if you can,
Definitely. Yes.
right?
That's
Okay.
not something that we want to go through. Yeah. Even injections can be pretty, they're a necessary thing. Like sometimes we have to do something of that nature, but even trying to avoid that as much as possible can really help, just in general, overall lifelong kind of pain, because you can only get so many injections until things start to break down as well. So that's definitely something that we try to avoid as much as possible.
Is there a different style for dealing with, let's say, a herniated disc versus a normal, whatever you would consider a normal patient?
um, yes, there are a few different, and it kind of depends on where the disc herniation is. But if we just talk in the low back in particular, there are many different things that you can focus specifically on. It kind of depends on where the disc is herniated to, where it's traveling. But there's a whole bunch of different protocols. I use kind of a mix of all of them. Kind of have a whole bunch of tools in your tool bag to be able to help whoever comes into your office. And basically, there are different things that you do specifically with somebody, because they're not able, in general, people that have a pretty bad disc herniation aren't able to move as well. You're going to have to get them into a position more comfortably than you would just a sprain strain, which are super painful. But that disc herniation, you really have to be in particular positions. And there are many different treatments that we can do off of that that are very helpful.
Okay. So I've heard, people that have herniated discs have limitations when it comes to, let's say, lifting or something like that, right? They have things that they've at least been suggested they shouldn't do or should be careful about. So is it similar in the chiropractic care? Are there certain adjustments that you would normally perform that you kind of stray away from for people with herniated discs?
I wouldn't say necessarily stray away from, but it's more just the positioning of getting them there to be able to do a certain joint manipulation, that we would be able to do it probably not as efficiently, but definitely more comfortably for that patient. And we would work up to getting them into being able to do the more of that, I would call it like a side posture or something of that nature, that they might not be able to get into that position without extreme pain. So we are able to do other things to be able to get them more comfortably and start that process of getting them back to being able to honestly just live a normal life.
Awesome. Very cool. So one other population that I was curious about is people that have arthritis.
Definitely.
Can joint manipulation be helpful for them? And if so, how?
For sure. So it kind of does change. It depends on what type of arthritis, obviously, but just in a general osteoarthritis, which is the most common, basically what happens with arthritis is the joint space starts to kind of move. You either get bone spurs, or the bone starts to kind of model itself a little bit different than the normal flat kind of surface that we kind of think about with joints. We start to get kind of jagged, and things don't like to move as much. So in that sense, what we usually try to do is get that joint to gap apart. So the more of the gapping of that joint, you do get a little bit more of that blood flow into that area, fluid flow into that area, to allow some things to move a little bit better. And that does take a lot of time to know exactly where that needs to move and how, and to gap it apart, rather than doing a slide, which usually with like a slide motion with arthritis, nothing really happens. It's usually kind of painful. So we try to actually gap that joint apart to allow it to move. And that helps. That seems to help people greatly. And then just getting that fluid transfer, because our arthritic joints usually get nothing because it hurts to move. So people don't like to move it. So the more that we get any fluid flow, blood flow to that area, really helps kind of just tissue transfer. So you actually get some blood flow, some nutrients into the joint, and really can allow for healing.
Interesting. I've never thought about the structural portion of that before, because I know a lot of people that have gotten, bone spurs or whatever. So the arthritis itself, we know is some type of inflammation. You're saying that it's essentially being caused by having some type of uneven, like rubbing, irritating, that type of thing, or?
It can, yeah, definitely. So, yeah.
Okay.
The actual definition, right? So itis would be inflammation and arthro is joints. So yeah, technically it is the inflammation inside the joint capsule is arthritis. Osteoarthritis would be the joint, like the bone of the joint starting to get inflamed. And usually with that, your body tends to put calcium there so that if you have a force that's on the body, then it starts to put more bone there. So it kind of models into that direction, which can be bone spurs, things of that nature, where you have a force on the body just, it doesn't matter where the force is, the body's going to put more tissue there, if it's bone, muscle, whatever. So if you have a strange force, because you're using your joint a lot, you can get bone spurring in that joint. Usually it's relatively, I would call it normal. You can have it be aggressive if you've really used that joint a lot. But for the most part, it's usually pretty normal, and we can kind of get it to calm back down.
Very cool. All right. Awesome. So then let's talk a little bit about adjustments throughout the body. We talked about the back, and I think that's probably the most common, at least where people would think chiropractic care is mostly back care, right? But can you manipulate any and all joints?
That's a great question. Yes. I, with a sports background, really focus on pretty much any joint. Any joint in the body can move and should move. There are plenty of things that can cause a functional issue, with pitchers and their elbows, shoulders, wrists. Their lower body too. You're landing on your ankle, you're landing with your knee, you're putting all that rotation through the hip. With that's just in one sport. You're using all of those with every time you're throwing. So I really focus on all of that. And being able to know exactly where that joint is supposed to move, how it's supposed to move, and to get it to either slide or gap apart in that whatever is appropriate for that joint, to be able to get it to move in that full range of motion so you can actually compete even to a higher level.
Okay. Do you see a lot of that from overuse as well?
Definitely, particularly shoulders and hips a little bit, but and definitely a lot of overuse. And honestly, a lot of that can be avoided with a lot of posture training and strengthening. If we were able to see these people before and being able to avoid that by fixing those structural problems that they were developing by being in an incorrect posture or overusing it without strengthening the antagonists, that's really where you start to develop issues. But that's where we would send, I would hope that people that are in sport are seeing some type of professional to fix those issues.
What are some other health modalities that you typically either recommend or maybe that you partner with as a chiropractor?
Do you mean like other like healthcare providers?
Mm-hmm.
Okay, perfect. Yeah. I personally think that physical therapy and or personal training. I think personal trainers, physical therapists are extremely important for everybody before injury, during injury, after injury, just to kind of elevate where where your body is. All of us are going to have some type of weakness and some type of overused, muscle with just living. Even if you're just walking, eventually something's going to get tight and something's going to get not used enough. And that's where a physical therapist, personal trainer, chiropractor can all at least identify that and get you to start using the muscle that's supposed to and lengthen the one that is being overused. So I love working with hand in hand with physical therapists and personal trainers. We also have to unfortunately sometimes use orthopedic surgeons, and I have been in with multiple different surgeries and seen how that works and all of that. There are times for that there isn't really much that anybody can do about it. Certain injuries, you just have to have surgery. There's nothing you can do. So I work with a lot of orthopedic surgeons, pre and post-op, things like that, being able to get people back. But that's really where if we can get all of them to join together and really focus on that with the prehab, the post-ab, as we talked about earlier, and getting everybody together, that's what really helps the patient succeed the most.
Okay. And you had mentioned massage before as well. I know that that's something that you offer at your clinic.
Definitely.
What do you suggest in terms of like before, after, a certain type of massage?
Great question. Yes, I love my massage therapist. I have the best group I've ever worked with here, barring a few that I've worked with in the past. But we work on the physiological kind of joint healing method. So basically, you need to have a joint loosen before you can get it really to move. So whether that's some type of modality like a heat or muscle stim, anything like that, to get that joint to loosen up, or soft tissue work, which sometimes is better, that can really help get that joint to be able to move easier with the adjustment. And then usually we like to stabilize the joint afterwards, which would be with some type of exercise to be able to once it moves, so it doesn't just move right back out of place, because that can't happen.
And you say after, do you mean immediately after? Do you actually have people do exercises?
Definitely. Yeah. We have a therapeutic exercise specialist in our office that that's all she really does, is just go through as soon as we do an adjustment. It's the next step to stabilize that area so you don't continue to have that issue. Postural changes, things of that nature.
Very cool. Okay. Awesome. And then something else that I know a lot of people have seen, we kind of talked about social media and how attractive, chiropractic adjustments are. People love those videos for some reason.
Yes.
Why do you think it's so viral, and why is it always so violent looking?
Yeah, definitely. I'm guilty. I watch them too, and sometimes I cringe because I'm just like, woof, I don't know. I definitely think that a lot of it is the shock factor of looking at that being like, whoa, like that's an intense adjustment. And even I'm like, I would never do that. But I think a lot of it also has to do with the big trend in ASMR too, where people, they hear the cracking and the popping, and it's satisfying to some people to hear that. Some people, that's part of the cringe factor, and they just like shudder when they hear that. So I think that's the majority of it. I go back and forward on whether I like it or not. Good for them. I guess they're making a business out of it. I don't necessarily think it's mocking the profession, but it's definitely shocking, some of those moves that they do. I
saw a video of a gal. She had like a bag of chips or something like that. She's like, you know what I mean? It's like, all right.
Yeah. I've seen those too. I saw one where they were like at a construction site, just like jumping through doors, and they're like, yeah, this is like your chiropractor jumping on you. And I laughed pretty hard at that, but it's definitely a funny joke. I have to laugh at it.
All right. So what do you think about, because obviously that is satisfying to be able to like pop, crack, whatever. How do you feel about self-manipulation, being able to like pop your own joints and stuff?
Sure. There really are two thoughts. I kind of more on the, I do it every day to people, so it can't, obviously what I'm doing is helping, but you can become kind of addicted to it. And that can be more of the chasing that dopamine release that we talked about before. So you're just consistently moving the joint. And the problem is that you're getting that joint that is moving easily to move consistently, rather than the one that actually is stuck in the neck. And that's where I come in to actually get that joint, to the one that's not moving, to move correctly. So you can get dependent on that, which we don't want that. But at the same point, like if you can do it safely, so like if you're just stretching and you're not forcing your neck to move, should be okay. Like even the leaning back on the chair, like you're technically kind of forcing that to go, so you probably shouldn't be doing that. But if you're just stretching and things move, it's usually fine.
Okay, because
As
then
long as
when
you don't
it's
get
like
sick.
foam rolled or whatever, you know that your back is going to crack like
Exactly.
that.
Right. And that's just stretching, I mean, there's multiple times that I do. I love this one stretch that's basically like a preacher curl for your middle back. And I get like 4 or 5 every time I do it, which is great. Now I know when I'm going to be doing my overhead lifts, my thoracic extension is actually going to be there rather than just, being all rolled forward. So it's a good thing to be able to do, just as long as you're not getting overly addicted to it.
Okay. Is there any negative to, let's say, like somebody cracks their knuckles or whatever? Like when we were kids, you remember they used to say that your knuckles were going to get huge, right? Like, is there a negative to having the same joint cracked all the time?
You can basically what happens with that is that that ligament starts to get a little looser. So now you're going through more range of motion when you're using it in general, right? So that's kind of why your knuckles can get more arthritis, because if you're consistently popping them. That wives' tale it's there's a reason that it's a wives' tale, is that it does happen, but it's more from creating that dependency on it, and now that ligament starts to get stretched out and it just moves more, so you get more arthritis in that area. It can also be if you're not doing it correctly, where you're gapping the joint apart and you're kind of forcing it and grinding it. You're kind of grinding that cartilage that's right there. So you're over, not the first time, but over hundreds and hundreds of times, you can start to degrade that cartilage, and there you go. You're starting to create arthritis that way.
Dang, there's actually a little truth to it.
Kind of, yeah.
All right, that's crazy. Cool. So then if we were looking for a chiropractor, how do you suggest, vetting them or finding one that works well for you?
Yeah, I'm more, I want to be kind of politically neutral on the chiropractic spectrum with this. I'm more on what's if you're in the chiropractic world, there's mixers and straights chiropractic. And the straight chiropractic is more of the ones that are only going to adjust just your spine, sometimes even just your upper neck. And that's it. And they're more of the view is that that's going to help your body heal. They're more of the ones that believe that the nerves are what causes all, they say, dis-ease in the body. So whatever disease is being caused is because your nervous system isn't able to react to whatever is going on, because that's, the nerves basically kind of control everything. I'm more on the mixer side, which would bring the more physical therapy, the modalities, other types of treatment on there that allow us to help the body heal faster. So I think that that's the better type of chiropractic. Obviously, I am biased in that since that's what I do. So I would say the majority of, if you look at people that are more either, I would say first off, word of mouth to know what exactly they do. Google reviews are a good thing. It's a necessary evil in the world, I guess. And honestly, if they're part of their local association, because that shows that they're there, trying to help the community out. They're not a fly-by-night person that's just going to pick up and leave. And then the ACA compared to the ICA. ACA is the American Chiropractic Association, and that is more of like the mixer, quote unquote, type of thinking. And if you're interested in more of that, then I would say the ACA is the better something to kind of look for.
Oh, very cool. And when it comes to care and frequency of care, I know it kind of depends on the person and what their injury is. What would you say is an average? How often do people or should people come in?
It's a fantastic question. Honestly, that's like the $1 million question. So it really does depend. It depends on the injury, it depends on their age. If it's more of a chronic versus acute, kind of what we went over before. And that's really the hardest part is gauging on how much they should be coming in. And it depends on how well your body responds to treatment as well. Sometimes, you you get one adjustment and we focus on you, like what muscles tight, and you're good. Sometimes it can be one time. Sometimes it needs to be months. It depends on how long, you've been in that position, if it is more of a chronic thing. And then, if it's more of an acute thing, usually it's in general, usually more acute. You need to come in more often because that joint has so much inflammation around it. It's moving all over the place. So we want to make sure that we're stabilizing it as well as helping it heal with all the other modalities. And then forcing the joint to move correctly more often, and then stabilizing it as we go along by that patient doing more exercises at home, things like that. Maybe, referring to a personal trainer, physical therapist. But that's it's a pretty hard question to answer. It's so subjective. And that's something else that I would be very cautious about, is going to a chiropractor that just has that for everybody. Doesn't matter what the injury is, 3 times a week, we need to see you that many times. That's really not necessary. Sometimes it is, I'm not saying that everybody is going to fit into that, but majority of the times you definitely don't need that 3 times a week for 5-6 months. And that's what's going to cure you. Because if you do your part and you do your exercise and things like that, you really should not need to come in that often.
Is there any situations where you've had somebody come in like daily? Is that crazy? In a perfect world, I would love to see all of my car accidents that fast, just to be able to get them to heal faster. Same goes for post-op. I mean, if I could see somebody post-op every day, as we do in athletic training, man, it would really help out. But with insurance, you'd blow through your visits so fast that unfortunately that's just not something that we can do. In athletic training, man, that's why I think you see, obviously those they're professional athletes, things like that, so they're higher caliber just when they go into surgery, but you see the response times to even ACL tears, how they've just greatly improved over years. And that's because of being able to treat them so often. I remember Edelman coming back after an ACL in I think it was 4 or 5 months, something ridiculous like that. And that's because he was able to get treated probably twice a day, for weeks. So I wish we could do that. Some people wouldn't be able to do that anyways, because that's a lot of treatment. But in general, I would say that it's that the 3 times a week in the very beginning for acute, post-op, things like that is pretty normal. But other than that, I'd be pretty surprised if you would need that. Okay. So when it comes to, let's say, maintenance, right, where we get to a good spot and you just feel like you want to go in every once in a while for a tune-up, right? That's what I used to see you for.
Yeah.
How do we, as the person or the client, identify when it's time to go in again?
Also a good question. So I might ruffle some chiropractic feathers here, but I have more of the athletic trainer view of this, where you don't necessarily, would it be better for you to come in at least once a month? Yes, definitely. Is that always possible? Probably not. I mean, I'm also a realist, I think is part of it, where I don't expect everybody to be able to do that. We try to set up our patients to be able to do a lot of the functional exercises on their own. We email them, we kind of give them when you get to here, you're doing here next. And that's if they can't go to a personal trainer, which I try to get them to do mostly, or at least, personal trainer, physical therapist, something. And if they can't, then that's definitely, we try to give them kind of a roadmap. And then we check in every visit. Hey, did you do your exercises? And kind of go from there. But in general, I would say if you're starting to notice, it's kind of when you go in for your eye doctor check and you're just I feel like I'm feeling fine. And then you get your new glasses, you're whoa, I didn't realize I couldn't see like that. It's kind of the same thing, so we tend to kind of get more into our typical movement patterns where, if we're at a desk all day, we start to kind of slouch down, things like that. Our neck starts to get stiff, we get headaches, things like that. So there are a few things that you can kind of notice. So if you're standing against a wall and you're not able to get your head against a wall, or it starts to hurt that mid back just by getting into quote unquote good posture, probably time to get in. Another good one, my chiropractor used to always say is, if you can't get your ear to your shoulder, you probably need to come in. So like, mine's a little tight, I probably need to get an adjustment up here today. But that's kind of in general, more range of motion things. If you're noticing your range of motion is not where it should be, then I would definitely think about going to get adjusted.
Okay, awesome. And then after you get adjusted, how long do you kind of feel the effects, and does it change depending on the person?
For sure. Yes, it definitely change. It kind of depends on, first, the injury, what's exactly going on. Again, if it's super acute, you're going to have a lot of inflammation in the area. So that adjustment's not going to last as long, because you have that like just inflammation around the joint. So it's just going to kind of be moving all around. The important part is that we're getting it to go through that range of motion. So we get that, with that moving all the time, you want it to be in that functional position. So we can try to get it to be used to being there. That's why we adjusted so often in the beginning. I guess I probably should have mentioned that before. Instead of it just being like, well, why do I go in at all then? Because you want it to be in that correct position so it can stabilize into that position. But usually, you should notice a change almost immediately. You should be able to kind of notice, like, okay, that does feel like it's moving. There are times where the muscles are so spasmed around it, like, yeah, we get it to move, but then the muscles are still so tight around it. Sometimes you don't get immediate relief then. But it really does kind of depend on the injury that we're dealing with.
Okay, definitely. Very cool. Is there anything else, as we're kind of wrapping up, that you'd like to share about chiropractors, chiropractic care?
I definitely love my profession. I've worked with, gosh, I can't even count how many different chiropractors now. And all of us have a little bit of a different view, which is fantastic. It's not all just, here's your prescription and there you go, which I love. I also love working with other professionals, that's also fantastic to be able to kind of marry a whole bunch of different thought processes together and really be able to figure out exactly what that patient needs. And honestly, just being able to make, even if it's a short-term relationship with somebody, knowing that their, life is getting better because of something that you're doing. And that's very rewarding. I definitely, that's what gets me up in the day every day, is to be able to go help people feel better, change their lives for the better, and really be able to get them to go back to whatever they weren't able to do. It's very rewarding. And I definitely enjoy it every day.
Excellent. All right. So what's next for you? You just said that you renamed your clinic, right?
Yeah.
So you're in Canby now. What
Yeah.
do you kind of see coming up for you next?
I don't really have any other changes. We're kind of expanding. We expanded to Malala. So I'm managing this clinic currently, and that's pretty much the long-term goal. I'm just trying to help as many people as possible in these two clinics, possibly growing to a third at some point. But right now, this is pretty much it, just focusing on this community and helping it as much as possible.
Excellent. And I always like to ask my guests if they have any resources that they'd like to share. Maybe if someone's interested in either getting chiropractic care or maybe potentially being a chiropractor at some point.
Oh, for sure. So the best resource that the one that I subscribe to is the American Journal of Sports Medicine. I read that all the time. So if they're interested in, honestly, with both chiropractic and athletic training, that's a fantastic journal too. If you have any questions about certain things, I guarantee you they have done an article on it at some point. Recently with my two kids, I haven't been able to read as much as I would like to. I can tell you all about Paw Patrol and Bluey and all of that with my 2-year-old Charlotte, my 4-year-old Audrey. That's pretty much all I get to do lately. But other resources, any medical journal is going to be somewhat versed. There is a British Journal of Sports Medicine that I also will refer to occasionally. But yeah, further, on chiropractic, I would refer to the ACA. is going to be the best thing to go to. You can look into the ICA if you want to see the difference of what exactly the thought processes are there. And then for athletic training, honestly, the CAATE is forget exactly what CAATE stands for, but CAATE is a fantastic resource for anybody that's interested in athletic training.
Awesome. Thank you so much. And then if someone wanted to get a hold of you and maybe had some questions, what's the best way for them to get a hold of you?
Yeah, for sure. Honestly, the best would be to go on our website. I know that's kind of cliche, but it's canbyspineandsport.com. That's probably going to be the best. We can kind of be able to converse through there, through the website. There's a way to email the doctor, things like that. And then, if you do want to get in contact with me in particular, you can also call the office. I can give you that phone number, but that seems a little weird too. But
I'll put it in the
okay, perfect. Yeah, for sure. But yeah, so that's usually the best. You can also always email me. I think you'll have that as well. So any questions that you have, with athletic training, chiropractic, what schools are great, where I've been and what I've seen, I definitely can. I did a lot of vetting on chiropractic schools, so I can tell you exactly what I think on all of them. So if there's any questions about that, I definitely would love to help anybody that has any questions about that.
Awesome. All right. Well, I appreciate you taking the time. Anything else that you want to add?
No, I just want to thank you for allowing me to speak today. It's been great. I love talking to a New Mexico State, alum. It's great. Congratulations on that.
Thank you so much. I know it was so weird when I literally got into NMSU already. And then I was like, oh yeah, I'm going to NMSU. You're like, yeah, I graduated from there. I'm like, what?
Such a small world.
What are the chances?
Yeah, seriously. What a great school, though. I miss New Mexico State a lot. Love Las Cruces. As we were talking about a little earlier, Miss Green Chili. Oh, so good. That's what a great school. The program that, especially athletic training program. I can't say any, the best people ever. I definitely miss that area.
Awesome. Well, thank you so much. It was so nice to see you again.
Yeah, good to see you too.
All right, we'll talk to you. Thanks.